So now for the diseases, here for bowel dysfunction, the first one that I will talk about it is diverticular disease. This one it's caused when naturally weak places in the colon give away under pressure. The treatment for this condition it's antibiotics and of course diet. And the diagnosis it is achieved through blood or urine tests and symptoms and symptom presentation. Now, for functional fecal incontinence, the cause can be muscle or nerve damage, hemorrhoids. Some part of the treatment can include medications, exercise, and surgery. And the diagnosis is achieved through digital rectal exam and rectal ultrasonography and anal manectometry. Now, for the polycystic kidney disease, this one it's the cause it can be genetics. That's actually one of the main causes. Treatment includes dialysis at the end stages and lifestyle modifications, which it is a huge part of this disorder. And then for urinary incontinence, treatment may include it is actually one of the conditions that can benefit a lot from physical therapy in some cases. Sometimes exercises, medications can also help. Now, in terms of cause, it is alteration in the structures or function of the urinary tract. The diagnosis, it's something to really keep in mind about this condition. It's that it is a symptom rather than a diagnosis condition. But some tools that or some tests that can be utilized to diagnose it. It is the bladder test, urodynamic testing, and post residual volume. And lastly, to conclude this presentation, one of the parts that was the most challenging as I was doing this concept mapping or organizing this concept mapping, I think it was the diseases presented this week. I think diseases regarding altered eliminations were new to me, so I had to really do more research in addition to the book. And so far that was kind of I will say the most challenging part of this concept mapping. Thank you everyone.